Okay, all of you all, thank you very much for hanging out with us for so long while we figured this out. Dr. Hannah has kindly agreed to give us a presentation on women's health in expedition, which is amazing considered she is herself is an expeditioner and does a lot of expedition and wilderness medicine. She worked in emergency medicine, anesthesia, and intensive care to registrar level prior to uh, becoming a GP in urgent care and remote area medicine. She is presently a senior clinical lecturer for undergraduate medical education and a GP advisor to the Scottish Ambulance Service. She got her form, which we all also trying to get, the fellow of the Academy of Wilderness Medicine in 2014, 10 years ago, and was also nominated as a fellow of the Royal Geographic Society for services to expedition medicine in 2014. So she does have a long-standing interest in wilderness medicine, and therefore her experience also provides a medical cover for endurance events and expeditions around the UK and globally. She also has a diploma in tropical medicine and hygiene and a master's degree in global health and infectious diseases. She's also completed her diploma in remote and offshore medicine after providing topside cover for some of the most remote oil fields. And as you can see, she is pretty amazing. Her CV speaks more than anything else, plus the work that she's done. And she's also recently returned from Antarctica, if I'm not wrong. Uh, Also a teacher and instructor for the ALS, AWLS, and multiple other expeditions and educational events. She also has completed an education supervision program to allow her to do more involvement in postgraduate education. She has certain experience in aviation medicine, repatriating patients from all over the world, and is a fellow diver as a PADI master scuba diver. So give it up for Dr. Hannah, and Hannah, all yours. Please go ahead.
Hello. Thank you very much for persevering with us with our technical issues. I'm not too familiar with Google Meet, so that was all my fault, I'm afraid. So I've been asked to give this talk on women's health on expedition today. Now I'm very, very pleased to be here and to be able to talk to you about this. It's something that's really important to me. Being a woman and being someone that goes on expedition quite a bit. So what do I want to achieve today? So I want to talk a little bit about women's health on expedition. I want to give you an introduction. I want you to appreciate how important it is for women to get out there and be able to do exactly as men do in terms of going on expedition, going on trips, traveling. And I'm going to talk a little bit about the different problems that women might face when they go on expedition, and a little bit about how we can sort of treat that, and how we can help them perform as best they can. Now, pre-expedition considerations, women might want to have a health assessment or a medical checkup before they go away. This might be to get medication or advice about delaying periods. It might be about control of symptoms of menopause. So it's worthwhile saying to women that if they want to do that, to do it well in advance of the expedition. They of course need to get their vaccinations up to date, as do we all when we go anywhere, and that will be relevant to the destination. I use a website called Fit for Travel to ensure that I've got the right vaccinations for it's a Scottish website, so I'm not biased at all, but it's a really good place to start. It's a bit like NAFNAC in that regard. So I just wanted to remind you of female anatomy. I'm sure this is teaching you how to suck eggs. So for women, we've got a vagina, a cervix, and a uterus. They're all connected. We've got ovaries, we've got fallopian tubes and fimbria, which are the finger-like projections at the end of the fallopian tubes, which sweep the egg into the tubes and therefore into the uterus. Fitness and training before. So women would be expected to do training exactly the same as men would be. So there's not really much to say there, other than especially women at menopausal age, preparing for things like the climate. So if you're going to somewhere quite hot, women that get hot flushes and things like that, they need to just maybe acclimatize to the heat. So that might be a consideration for you. Mental health, so really important to consider, how mental health might affect women when they're on expedition. Stress management techniques, and support networks. So when I'm on expedition, I always encourage people to have a buddy system whereby they've got a buddy who can keep an eye on them and let you know if there's any sort of changes that are worrying about that person. So that's a really good way of keeping an eye on everyone when you've got big groups of people going on expedition. So we'll talk a little bit about menstrual health. We'll talk a little bit about management of those, including menstrual cups, tampons, and hormonal suppression. A little bit about hygiene now. All I really want to say about hygiene is that, making sure that someone's got somewhere to wash their hands and a way that they're comfortable with to pass urine. I'm sure lots of people aren't used to, peeing in a bush, and aren't very happy with doing that. So, ensuring that there are places that people can go to do that. A little bit about urinary and reproductive health. So especially people that are prone to urinary tract infections and yeast infections, if you're going somewhere a little bit hot, they might be a little bit more prone to getting those. So, they might want to ask their GP when they're at home before they go away if they can have a emergency supply of medication of antibiotics or treatment for yeast infections to take with them. And you want to make sure that people that need contraception have got a reliable method of that, and that method's going to prevent pregnancy during the expedition, depending on what you're doing. So lots of people are uncomfortable with peeing in the wild. There's quite a few different options of other ways that women can pass urine in the wild. I'll just forward on. So there's the female urinals, or the shiwis. They take a little bit of practice to get used to those. So make sure people have managed to have a practice with them before they go. If you're going to suggest people bringing them if they're uncomfortable peeing in the wild. And you can get these sort of, Nalgene is the make, but you can get these sort of other urinals that people might not have seen before. So I just thought I'd put that in there. So environmental concerns. So with remember that women have a higher fat ratio to men with muscle, and our basal sweat rate's a little bit higher as well because of that. So those are the environmental concerns that I want you to consider when you're taking women, especially to warmer climates. Dietary needs. So on expedition, we all need a good diet, especially if you're doing something that's quite energetic, and especially for women who may be anemic, or have had problems with anemia before. They need to make sure that they're taking enough iron. So that's really important. That might be something that they would want to see their GP about before they go away as well. If they have had anemia before, it's obviously going to increase their chances of having you know, poorer oxygen carrying capacity in their blood. And so it might be something that they need to take iron for example, and that's not something that can happen overnight. So it's something that needs to be planned well in advance. So again, I'd recommend that women go and see their GP well in advance to get that checked and sorted if it needs sorted. Strategies for maintaining hydration, so making sure that they're drinking enough, making sure that they're especially in places that are hot, making sure that they're having I recommend participants to have ORS or rehydration salts. I recommend that you know, a sachet of that in the morning and a sachet of that in the evening, just to make sure that you're getting all of the salts that you need as well if you're sweating a lot. So there's not really any evidence to suggest that women get more altitude sickness than men do. It's about recognizing the symptoms. So it feels like a hangover. So you get a headache, nausea, and fatigue. The cure for it, there isn't really a cure, but coming down is definitely a good treatment to begin with. And you can treat it with medications such as acetazolamide or Diamox. So those are things if you go into altitude to make sure that you've got. So women get hypothermia the same as men do, frostbite, and they can get heat exhaustion and heat stroke as well, exactly like men. So we need to bear that in mind when we're taking women on expedition. Essential medical supplies. So I always recommend that people bring a supply of paracetamol and ibuprofen. If you've got if you're expecting a period during the expedition and you don't want to take medication to delay that period, things like having a menstrual cup, tampons or sanitary pads, whatever the lady's comfortable with, bearing in mind that things like tampons and sanitary pads are bad for the environment. So there are a newer sort of ways of dealing with a period during an expedition especially. There are also menstrual pants, so with a sort of integrated sanitary pad that you will need to wash, so that's the only consideration with those. Menstrual cups are pretty good. They're made of silicone usually. They need washed with potable water, and they're good for the environment because you can reuse them. And you obviously need facilities for somebody to wash their hands when using any of these. You might want people to consider contraceptives while they're away. Sex does happen when people are away, so making sure that you've got a supply of condoms and pregnancy tests is a good idea for going away on expedition. The lady might be taking an oral contraceptive, so things like nausea, vomiting, things like diarrhea or illnesses affect absorption of these things, so you've got to be a little bit careful. And I'd always advise a woman to have a secondary method of contraceptive when they go away. IUDs is intrauterine devices, so that's your things like your coils. So women might have those. Some coils make periods go away completely, such as the Mirena coil. Other coils, such as a copper coil, can really disturb periods and make them quite unpredictable. So that might be something that you want to discuss with a woman if she wants to discuss it before you go away. She might be used to it by now and has got another method of dealing with a period should that come whilst she's away. So again, teaching how to suck eggs. So menstrual cycle starts typically about age 12. stops menopause. Average age in the UK is 51. So around that time, and that's how much blood is lost. So it's not that much really, and when you consider how much it could be. So menstrual cycle, you get day 1 to 5 is your period essentially. Day 6 to 16, you get your endometrial tissue thickens, and you get ovulation on day 14 or thereabouts. And there's an increased blood supply to the uterus after that. Days 17 to 28, your estrogen and progesterone levels fall, assuming there's no pregnancy, and the cycle starts again. You get your period. So that's how you ovulate. I'm sure, again, much of you will know exactly how that is. So that's what happens to the follicle as it develops, and you know, preparing for ovulation on day 14 or thereabouts. Uterine lining, so we talked a little bit about that. It thickens day 6 to 16, and ready to be shed on your period. So cycle control, so there's many ways to control somebody's menstrual cycle, as I'm sure a lot of you will be aware. The combined pill has got estrogen and progesterone in it. Typically it's taken for there's a new way of taking it. So it used to be that you'd taken it for 3 weeks and then stop for a week to allow for a period. Now what they do is suggest tricycling, so that's when you take it for a total of 12 weeks. You can just completely avoid the break, and that avoids getting a period. So that's certainly, if somebody was on the combined pill, that's certainly what I'd be advising them to do when they're away, is just to keep taking it every day. And you need to take it around the same time each day, roughly. But again, things like diarrhea and vomiting illnesses can affect the absorption of it. So just be aware of that, especially if you're somewhere where people are more likely to get sick. Contraceptive patch, I won't say very much about that. They're not very common, especially in the UK. We just don't really use them that much. Progesterone only pill, or the mini pill. This is a pill that you need to take the same time every day. It can change your menstrual cycle. It can lead to strange bleeding at different times of the month. So if you don't take it at the same time every day, it can lead to problems with unwanted periods happening. The same with the Depo-Provera. So that's a 3-monthly injection that women get to stop or to try and control their menstrual cycle, or you know, be used as a contraceptive. The implant is another method of contraception. It causes disruptions to bleeding. So again, it's not one that I would advise for, you know, if somebody was wanting to have a method of contraception to go on expedition, I would probably suggest something like the Mirena coil. But that would have to be arranged months in advance, because it takes a little while to settle down bleeding, and you can get bleeding, quite heavy bleeding, for a few months while you're sort of your body's initially getting used to it. Couple of things to delay periods, so norethisterone, and there's another medication called Provera or medroxyprogesterone. These are probably the most common thing that you're going to see on expedition, is people getting these from the GP. You basically keep taking it to delay periods until your periods, until you're okay to have your period. So that these are really handy things to know about, and to suggest to participants. So I think we've covered most of this stuff already. Pads, period pants, tampons. Remember with tampons, if they're left in for too long, they increase your risk of toxic shock syndrome, which can be pretty nasty. So making sure that people know to change them regularly, and there might be a reluctance to do that depending on where you are and what the toilet facilities are like. There are many types of menstrual cups. There's even a quiz that you can do to try and work out which cup is best for you. So I'm not going to dwell too long on those, but it's definitely something that I would advise participants to get if they've not got one already, and get used to it using it, because they're really handy, and they only need a rinse, and they don't really need washed every time that you change it. They can be a bit of a fiddle to start with, so you need to warn people in advance, and they will then they can do the quiz, they can buy one and get used to it. So they're really handy. We've talked a little bit about this already. So anemia, heavy periods especially, can cause it, and they might need iron treatment for that. So women can get a strange thing called Mittelsmurz, which is pain in the middle of the menstrual cycle. So around day 14, when you're ovulating. So it's basically the egg coming out of the ovary. And it tends to present, some women can get it worse than others. Some are just sort of aware of a discomfort. It can be it can look a little bit like an acute appendicitis if it's on the right. So generally monitoring these people and giving them some pain relief, and that should be that. Dysmenorrhea, so painful menstruation, can be a real problem. A lot of people have problems with it. Some of the hormonal methods that we've talked about of controlling periods can aid with this, can lighten periods, and some of them can make the periods, especially things like the copper coil, that can make things a little bit more difficult and a little bit more painful. It's caused by prostaglandins, which are released during your period. It can happen more commonly in women that have endometriosis, pelvic inflammatory disease, or anatomical abnormalities. Cramping, general discomfort in the lower abdomen, and pain. Treatment is ibuprofen. There's not very much evidence for paracetamol in these women. Massage, heat. So for example, on expedition, you might have somebody that normally uses a hot water bottle for their pain, and you could use an Nalgene and get somebody to give you some hot water for that woman, and get her to wrap it in a t-shirt or something like that so she doesn't get burns. But yeah, something like that is something that you can fashion to help with pain. Secondary amenorrhea, I'm not going to dwell too much on this. It's basically the absence of a menstrual period when the woman's already had at least one period. So you have to have started your periods to have this, or be deemed to have this. The causes are pregnancy, ovarian tumors, altitude can cause it, and intense exercise and stress can cause it as well. So you can imagine that this might be something that happens on expedition when there's a combination of these things at play. So PMS is a group of symptoms that women get just before menstruation. Some can carry on through menstruation, some can even be there a few days afterwards. We don't really know why it happens, probably a hormonal influence. You can get depression, anxiety, bloating, headache, food cravings, and breast tenderness. and some swelling. The treatment for it is to treat it symptomatically. So depending on what the patient is complaining of, vitamin B6 can also be helpful for it. So if women don't necessarily want to take hormonal medication or pain medication, you can advise them to try that, and exercise can be helpful as well. So lots of infections that are very common in women, or more common in women, especially yeast and bacterial infections, especially in hot, humid environments. We think it's caused by lowered body resistance, diets that are high in sugar. Antibiotics can definitely cause yeast infections, and diabetics can be more prone to them as well, and poor hygiene as well. Signs and symptoms: you get excessive or malodorous discharge from the vagina, redness, sore, itchy, burny, that sort of thing. There's a few different things that you can, a few different tests that you can use to restore the acidity of the to check for these things. You can get over-the-counter tests for them, especially trichomonas, which is a specific vaginal infection. These patients, you might need to evacuate them, especially if you haven't got medication to help them, which you may not on expedition. It just depends what's in your med kit. But patients that get these things on a regular basis, I'd be asking them to bring treatment with them. It may be quite sore, so some paracetamol or acetaminophen, whatever you want to call it, and you might need to evacuate them if it's not improved within a few hours. Best prevention is education, so making sure that people have somewhere that they can shower, or wipes and things are quite handy for things like this. Avoiding excessive sugar, especially in your diet, is helpful. I'm not really sure about the influence of coffee and alcohol. I guess it's because I'm not really too sure why they say to avoid those things. So I'm sorry about that. Encouraging cotton underwear and loose fitting clothing as well is really helpful. UTI is very, very common on expedition, very common in women generally. Increased frequency, urgency, burning on urination, any of these symptoms is best just to treat with antibiotics. Encourage them to drink lots of water, frequent urination when they need to, so that the urine isn't stagnating in the bladder, and cleaning with soap and water. There's not very much evidence for cranberry juice anymore. We don't tend to recommend it because the evidence is quite weak. If it's getting worse, or if it's lasting longer than a few days, I'd be thinking about evacuating that person, just because they might need their urine sent away to a lab to determine which antibiotic they need. But there's some pretty common ones. Trimethoprim and nitrofurantoin are the two that we use in the UK, but you'll have ones that you use in your country more commonly. Pelvic inflammatory disease is a condition where you get inflammation of the fallopian tubes, peritoneum, ovaries, and or the uterus. It's usually caused by an STI. You get pain in the lower abdomen, you can get bleeding during intercourse, discharge, fever. The patient could be quite sick and get nausea and vomiting as well. If you've got somebody with this, it's unlikely that you're going to have an antibiotic that they need in your kit. So the likely treatment or management of this is to evacuate that person. Toxic shock syndrome, we spoke a little bit about this before. It's caused by Staph aureus. It's caused by leaving tampons in for prolonged periods of time. You get high fever, abdominal pain. You can get strange symptoms like sore throat and muscle aches. and nausea and vomiting. These patients can get quite sick, so it's quite important to think about how you would manage somebody like this in the wilderness. They can get a rash, and the treatment is to remove the tampon immediately, drink lots of fluids. They might need antibiotics, and therefore somebody like this, I would be probably evacuating them. So we've talked a little bit about these conditions and the when we would think about evacuating. If you've got somebody that's sick, you're going to be evacuating them sooner than this. I've included some obstetric emergencies, and we'll just whiz through them because some women may not know that they're pregnant when they go on expedition. Some women can go on expedition. I probably wouldn't advise it after after 36 weeks or so, especially if somebody's their oxygen carrying capacity has changed and their exercise tolerance has changed. So the best way to avoid problems is to advise people to avoid traveling unless absolutely necessary. Normal pregnancy, you've got a placenta which provides blood to the embryo. You've got an umbilical cord which connects the placenta and the embryo. It's usually got 2 veins and 1 artery in it. And you've got the amniotic sac, which is a thin membrane that covers the fetus and contains the fluid, roughly about 1 litre of amniotic fluid. Pregnancy normally lasts 40 weeks, as we know, and the woman might start to feel a baby move around 20 weeks, and that's what a term infant weighs. I'll show you that, which I'm sure you've all seen before. Signs and symptoms of pregnancy, so absence of an anticipated period over 2 weeks late in somebody that's not on contraception. Somebody that is on contraception but it's not worked as well can definitely get pregnant as well. So carrying that pregnancy test kit is really important. People can be very tired, unusually tired, nausea and vomiting, so the morning sickness and breast tenderness can happen as well. Obstetric emergencies, so we'll talk a little bit about miscarriage or spontaneous abortion. It's a natural process that might need no intervention whatsoever. It can feel like a very heavy period. You'll get cramping and bleeding, and the woman might pass fetal tissue and placenta as well. The cramping and bleeding should then settle quite rapidly after passage of those things. But yeah, women who are going through this will need emotional support as well. So so getting them out of there is definitely something that that I would consider doing. Ectopic pregnancy, so that's when you get the embryo implanting in the fallopian tube instead of in the uterus itself. It's usually up to about 6 weeks, pretty early on in pregnancy. You can get it can be quite a serious thing. They need emergency surgery. This is a life-threatening emergency, and any woman that you're suspecting with symptoms of an early pregnancy and vaginal bleeding, you just need to get them out of there. So that's where the fetus sits, just in the fallopian tube there, and as you can imagine, that increases in size and can cause pain and bleeding as well. Premature labour, I'm not going to dwell too much on this because it's very unlikely that you'll have somebody that's that's that pregnant on expedition. So women are less likely to travel really later on in pregnancy. Problems with having a baby too early, immature lungs, problems with hypothermia, temperature maintenance. That's why babies that are premature are delivered into little bags these days to keep them warm. and blood loss. You might get increased blood loss with premature infants, and they're just generally a bit more fragile. 3 stages of labor. So as you can see, I've noted it down in times. So 8 to 12 hours, 30 minutes to 2 hours for stage 2, and then 5 to 10 minutes for the placenta to be delivered. So these are things that you might want to consider if you're in a situation. It might be somebody local that you've come across that needs help delivering their baby. The more babies the person's had, so the more parity we say, the more Paris the lady is, the faster the process. Dry cloth, clean hot water, soap. So as you can see, clean the area, inspect the perineum, looking for baby's head, help the vaginal tissues to stretch to try and avoid tearing. There you go. That's a photo of what the anatomy should look like about 40 weeks. Now there is a video there, but I'm not going to play it. It's just of a normal childbirth. It's yeah, it's fairly, you can have a wee look on YouTube. So ideally you want the baby in this position when you deliver it. That's what a sort of a normal vaginal delivery looks like. Delivery of the head, so you want to support it with your hand, clear the baby's airway, so get any muck that's in there out. Delivery of the shoulders, so you don't want the shoulders to get stuck, so you first pull the head down and then up and then hang on, and the baby should come out itself. Place the infant on the mother's chest or abdomen, and if they're keen to get started with feeding, you can do that. Dry the baby quickly and completely, especially the head, because that's where they lose their heat from. And just encourage bonding, and if mum's wanting to breastfeed, you can encourage that straight away. So for the umbilical cord, you can tie it with string in 2 places and then cut between the strings, and check that it's got 2 veins and 1 artery in it. So the next stage, so stage 3, happens quite a few minutes after the baby's born. The placenta begins to separate from the uterus. You might get a bit of a gush of blood at that stage, and you'll then get the placenta coming. If you cut the umbilical cord with enough length to be able to use traction, and then pull it gently to aid its delivery. So a bit like that. Hopefully this isn't a situation that you're going to come across or need to be involved with. Post-delivery, so you massage the woman's uterus to minimize any residual bleeding and to encourage contraction, so to encourage all the other bits and pieces that are in there to come out. Encourage breastfeeding, we've already talked about that, and gently cleaning and covering the perineal area and cleaning the birthing area afterwards. If they're both are well, just rest, eat, drink lots of fluids and relax. Encourage breastfeeding, as I've said, if mother wants to do that. If the umbilical cord's around the baby's neck, you attempt to slip the cord over the baby's head. Alternatively, you can tie it in 2 places and cut it. If the cord is cut, you need to deliver the baby very, very quickly. Breech presentation, so the definition of that is any part of the infant's head, any other part of the other than the infant's head is the presenting part. So mainly the feet and the buttocks are the most common. You need to immediately evacuate this person. These babies are very, very difficult to deliver. I thought I'd put in a little slide about menopause. So sorry, it's teeming with rain here in Aberdeen. So I thought I'd put a little bit about menopause. So women might want to go on to HRT or herbal remedies, but get them to do that months before so that they get used to it, and make sure that it does help with the problems that they're having. Hot sweats in hot environments can be a problem, so acclimatization to heat is important. Typically women get hot sweats, mood and sleep disturbance when they go through the menopause. These can all be treated quite successfully with HRT or sometimes even with herbal remedies, and some women prefer that. HRT can be delivered as a patch or a tablet. It can also be applied topically. So there's quite a few different ways that a woman might present to you with HRT. There's no evidence to show that women of this age differ in performance at altitude. The progesterone increases and enhances respiration at higher altitudes. So, that might mean that they're a little bit fitter to conduct the expedition. Really small point, but quite important, is if women are buying kits specifically for a new expedition that they're going on, if they want to buy new kit, there's plenty of kit out there now which is women specific. It just fits better and prevents rubs or blisters. So getting people to, if they're going to invest in a new backpack, for example, getting them to try on some women specific ones might be helpful. It might be that they do go for a man's one or borrow kit from other people. Just be aware that this might mean that they get blisters and rubs, so it can cause skin problems. So in summary, 98% of babies are born with no complications. Any delivery in the wilderness is a cause for evacuation of mother and child. I'd say that's it's pretty accurate, especially if I'm not an obstetrician, so I'd be wanting to evacuate these people and their babies, obviously. Monitor the patient for shock, so using your ABCDE or your March categories, and just allowing them rest and to taking care of them. I'm apologizing that that's a complete rattle through, but if anyone's got any questions, please let me know. I'd be happy to attempt to answer anything that you come up with. But thank you very much for listening, and I hope that's been helpful.
Thank you so much, Dr. Hannah. Any questions? We are open. If you don't want to open your mic up or video, we can just put it in the chat as well. I have a question for sure. I'm just going to wait for a little while and then maybe go ahead. We'll let people ask some questions and then maybe ask it.
Go for it, Vish.
So there was a question a few days ago on another forum on diving in menstrual cups. And the question was whether there's a chance of getting a squeeze from the empty space in the cup. And not having no experience with a cup or menstrual cycles, I wouldn't be able to answer that question. So I was wondering if you had any knowledge of that, or especially as a diver.
Yeah, I don't. I'll be completely candid. I use my cup when I'm diving, and don't seem to have any problems with it. So yeah, from personal experience, it's they work fine. Even if you were to get a bit of a squeeze, it shouldn't make much of a difference, because the cup has got suction anyway because of the way that you prepare them to put them in. They've got their own sort of suction, you know, inside. So yeah, I don't know specifically the answer to your question, but that's what I'd say from that.
Right, sounds good, because I was trying to correlate it with using P-valves, and we use dry suits, and they used to be balanced and unbalanced ones earlier. Now most of them have are balanced, and then in the unbalanced ones, you had to prime them with either fluid or urine to make sure that it didn't squeeze you. Now with the balanced ones, you don't have that problem. But given that a menstrual cup is not balanced,
Yeah,
there was always that question. But it kind of makes sense that it has its own suction. It's probably getting primed by itself as you get
yeah,
ready,
exactly.
and
Yeah,
uh, it's also it's not a fixed material, right? It's it's
exactly. Yeah.
well, thank you. That's a
No problem at all. I'm really pleased to have been able to catch everyone and to speak to you. It's been a pleasure.
and thank you so much for doing this on
Okay.
really
No,
short notice for us.
no
Uh,
worries at all. No
I
worries.
apologize for not choosing the right platform, but
Fine. Okay. Well, thank you very much.